Why are you working on my foot when my back hurts? Good morning, everybody. This is Dr. Amy with Physical Therapy for Everybody. And recently I had a patient come in and ask me, why are you working on my foot when my back hurts? So this happens a lot around here where we find something that's not the direct cause of the pain or not where the direct pain is, but that's contributing to that pain. So I wanted to hop on here this morning and give you a little bit of explanation about why we will work on your foot when you come in complaining about your back hurting. Because a lot of people have this question of how is it all connected? So that's one of our favorite phrases around here. It is all connected because your body literally head to toe is completely connected, but it can be difficult to see and understand. So we spent a lot of time in the clinic trying to explain that, and I thought I'd spend a little bit of time on Facebook Live today trying to explain it to you. So there's a story behind this. Obviously, this question of why are you working on my foot when my back hurts? So I had a patient come in recently, and she was having problems in her back, hips, SI area, so kind of pelvis. Think of that pelvic area. And she had gone to a chiropractor and had gotten really good results. She was pain-free for I think it was a couple weeks, and then all of a sudden it all came back. And then every time she got adjusted after that, she would have the relief for a couple days, but it wasn't sticking around. So her chiropractor sent her over here and was just like, okay, we need to be working together on this because obviously the muscles keep pulling everything out of alignment. So I, did a standard evaluation for us here, watched her walk, watched her move, tested this, tested that. And it definitely is her SI joint that's causing the pain. So that's where everything actually stems from. But the reason why her SI joint kept getting all wonky was because her foot didn't move. So when she was walking, your foot has to kind of be able to bend back and forth, right? When you're walking. And hers didn't. Her foot really didn't move at all. And she's an active person. She says she's not that active, but she's doing so much work around her house, renovations and stuff like that. Oh my gosh, she's fantastic. I wish I had all of her knowledge and skills. Anyway, so she's super busy around the house and she's, walking around and doing all these house renovations and stuff like that. And obviously putting a lot of force through her foot, right? Well, if your foot's not moving correctly, you move up from the knee through the hip, it goes the SI joint and then into the lumbar spine. So in her initial evaluation, I explained this to her and then asked her, can I have like 10 minutes to go ahead and work on your foot so you can see the difference that it makes, so you can understand more why it's important? And she was like, well, I guess, but it seems kind of weird because the pain's in my back, in my hip. But she was gracious and she gave me 10 minutes. And after we got that foot moving, it was easy to see how when she walked, she wasn't getting as much of that torque through her SI joint. So it wasn't moving all the way up her leg into her hip and her SI joint. Now, we did have to go and we need to directly work on that SI joint because it's been wonky for just way too long. And we have to do some muscle reactivation and everything up in there. But it's been fascinating for her to see, like, wow, when you get the foot moving correctly, then you don't have that abnormal torque somewhere else in the SI joint, which is where she actually gets her pain. She has no pain in her foot. She's never had pain in her knees or her hips. It's all been in that SI joint, but it's all being driven by what's going on with that foot. So I wanted to share this story with you because this happens a lot around here where we are working on one particular area. You may be like, I have shoulder pain and we have to work on your neck, or you may have wrist pain and we have to work on your neck because all the nerves that are in your wrist, all of them start up in here in your neck. So we do that a lot because we want to make sure that everything in the entire chain is moving correctly so that you can get the results that you're looking for. So that in 6 months, you don't come back and say, oh, my pain has come back. That is not what I want. I would love to have you come back into the clinic after you've finished your treatment, but I would like it to be for a different problem. I don't want it to be for the same problem again, because that means we didn't actually solve it the first time. And so that's really important to us here, that we not just deal with the pain and the issue that brings you in here, but that we look at the long term, what's contributing to this issue, what's not moving correctly, what needs to be muscle reorganization, whatever it is, but that we deal with the root of the issue. That's what we call it. And that's the thing that's actually driving the pain or the dysfunction that brings you in here in the first place. So it's really important to us to deal with the root, because if we don't deal with the root, that's when that problem keeps coming back and you're, 6 months later in the same boat, you're 10 years later having to have a second surgery. That's when all those things compound, when we don't deal with the root of the issue that caused you to come in here in the first place. So I hope this helps so that you can understand why we might be working on your foot when you come in with low back pain, or why we might be working on your neck when you come in with wrist pain. That everything works up and down the chain. And we want to make sure that when you leave here, not only are your goals met, not only can you do everything that you want to do, not only obviously are you pain-free, but that you have all of the tools and all of the motion and all of the strength that you need to do all of the things that you want in your life, and not wind up here again for that issue again. If you have any more questions about this, please feel free to either drop a comment below or go ahead and give us a call. We would love to schedule a discovery visit to have a chance to talk to you about how your foot problem might be connected to your low back pain, and to help you get on your road to doing all the things that you love to do. I hope you guys have an awesome day, and I look forward to seeing you next week. Bye.